This segment is sponsored by Brimo Pharmacy.
With over half of Americans taking some sort of vitamin supplement daily, it's important to know whether what you're taking is beneficial or not. Catherine Carey with Brimo Pharmacy is back. She's going to help clear things up for us. Catherine, this seems like it would be pretty cut and dry, but it really isn't.
Yeah, there are a lot of unanswered questions about vitamins. Some people are strong believers, and others feel like they may even cause harm. So it's a good to have a foundation.
I'm definitely of the camp of Team Vitamin. I mean, I take a handful of them every night. But one of the most important ones seems to be the multivitamin. But what should you expect from that?
Right, I guess the first thing is to have realistic expectations. So years ago, there was a lot of research saying that vitamins could prevent cancer and prevent heart disease, and some of those things have been disproven. So from a multivitamin, basically what you're getting is a little insurance policy in case you're not getting all the nutrition you need from your diet. So they can help you feel better and can prevent some side effects, but probably not going to make you live longer.
They're a supplement because they're supplementing things you're not getting from your main intake from your diet. But is there somebody who particularly may need to take a vitamin supplement?
Yes, there certainly anyone who doesn't follow a healthy diet or doesn't get a variety in their diet could benefit from a diet. But there are certain individuals that are more likely to have not get the nutrition they need from their diet and may benefit from a supplement. The first would be your seniors. So seniors don't always have the same acid level in their stomach, so they're not able to pull as much nutrition out of the food that they eat. Also, sometimes they don't have the appetite that they used to have. So seniors frequently can benefit from a multivitamin. Also, a big group is women of childbearing age, making sure that even before they become pregnant, they have a good foundation because that's so important in preventing birth defects. And then the other big group is people who are taking medications. There are actually some medications that can deplete us or block us from getting the nutrition we need out of foods, can benefit from supplements.
So seniors, women of childbearing years, and folks who may be on certain types of medications. Now, you may or may not know that some of the ones that you're taking would interact or block the beneficial, assets of a vitamin. But Brimo works with folks to be able to help kind of demystify that.
Yes, so we try to be a resource for people, letting them know if they're on a medication that can put them at risk and where a supplement may be a good idea.
Fantastic idea. You guys do that multivitamin program. Are there differences in folks who may benefit from multivitamins? I would think kids. It seems like you're always talking about here, take your vitamin, here, help with the vitamins. Are kids one of those key groups?
Well, kids, I guess there are two reasons. One, because they're in their developmental years. It's so important for them to get a balanced diet, but also kids tend to be picky eaters, and so maybe they're not eating a variety of foods. They may be either they're not eating their vegetables or they only want the carrots or something very, very narrow focus of what they're eating. So those are the two reasons that it's a good idea to give a child a supplement. Now, if you have a child that is eating a very well-balanced diet, then they may not need one.
I would like to meet that child because I have yet to have that at home. And we do a multivitamin because it does give you peace of mind. We've talked a lot about multivitamins. There is a wall full, an aisle full, stores full of different supplements. And this is where it can get really tricky because there are things that have to meet a certain standard. And then there are also ones that you might be taking that could interact badly with prescription medication you're taking.
So when you're choosing a multivitamin, I guess one of the things is making sure that you've got a reputable brand. Unfortunately, vitamins aren't regulated as tightly by the government as medications are. So sticking with a good company, making sure we try not to carry brands that aren't reputable, and then having the one that's the right blend for you.
Catherine, thanks for being back with us.
Sure.
Appreciate it. You can always come in and see the team at Bremo Pharmacy. You can meet with one of Bremo's pharmacists to help decide if you could benefit from a vitamin supplement. The Staples Mill location is in the Crossroads Shopping Center. That phone number is 288-8361. You'll also find Bremo in the lobby of Henrico Doctors Hospital on Skipwith Road in Suite 201. That phone number is 285-7730. For information, visit bremorx.com. Right now, we'll send it over to you.